Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Samina. May I know what brings you here today? Okay. I'm very sorry to hear about it, Mrs. Samina, and I totally understand that being a parent, how stressful the situation would be for you. May I know if your child is accompanying you, if he is at clinic? Okay, so bring your child with you on the next appointment. I would like to examine him properly and have a chit chat with the child. Okay. Okay, so Mrs. Samina, first of all, let me assure you that it is not a fault of the child. Okay, his involuntary bedwetting is not in his control. Okay, it's only a developmental delay which will be corrected with time. Okay, may I know the exact age of your child? Okay, Ms. Samina, statistics shows that 8% of children aged 4.5 years is involuntarily white during sleep or more than 2 nights per week. And however, there are certain lifestyle changes and certain medicines available. You'll be able to go out of the city and for the vacation. Okay, can I ask you a few more questions? Okay, is he dry during the day? Okay. Does your child have bowel control? Okay, he has. Has your child been dry ever before? No. Okay. Is there any emotional problem due to punitive measures? Okay. Okay. So, has he complained of maltreatment? Okay. First, let me assure that. Okay, if he goes to school. So, has he complained of maltreatment and bullying at school by teacher or friends in the last 2 months? No. Okay. Is there any family history of such problem? His father has a similar problem. Did your child have any spinal injury? Is there any tuft of hair at the back of child? Okay, Ms. Samina, I'll offer a few investigations, okay, in order to better understand, okay. I'll offer you urine culture and examination and blood sugar fasting and 2 hours after meal, okay, and HbA1c, okay, and I'll advise some lifestyle changes, okay. And so, Mrs. Samina, I offer you certain lifestyle changes which will help in having dry nights till the control comes. Okay. And please reassure the child that it is not his fault. It's only a developmental delay, and do not take punitive measures. Okay. And just limit the fluid intake to 1 to 1.4 liters per day. Okay. And if he takes tea or caffeine. So yeah, please avoid tea or caffeine, especially in the evening time, and train him to go to the toilet 4 to 7 times during a day and also before going to bed. And offer a reward system like star chart in his room. He will get restored on going to toilet before bedtime rather than at dry night. Okay, and ask him you should set an alarm for self-awakening at the midnight. Yeah, do you know about this alarm? Okay, Mrs. Samina. There's if these lifestyle changes doesn't work, then we have an option of Enuresis alarm. Okay, for this I'll refer you to a school nurse or pediatric Enuresis clinic. Okay. And they'll teach you how to use this alarm. Okay, actually a sensor is put in the undergarment and the alarm goes off when the urine makes contact with the sensor. Okay, and when the actually a sensor, and with the time child wakes up in a response to the bladder contraction rather than contact of urine with the sensor before alarm goes off. And this alarm becomes effective in less than 4 weeks' time, but may take months until child is completely dry at night. Is it clear to you? And you have to continue until 2 weeks after achieving dry nights, okay, and restart if repels occur. Okay, is everything clear till now? Okay. Okay, so Mrs. Samina, as you are concerned that as for your desire to go out of the city and for vacations, there is a medicine called desmopressin actually, which can be used for short time as a rescue medicine. But this drug is really specialist initiated. Okay, and this is a synthetic version of anti-diuretic hormone taken at night, and this drug is not without side effects. Okay, so you should know that the side effects include headache, nosebleed, and face flushing, tummy cramps, nausea, nasal congestion, and sore throat. So you need to be very cautious to start this drug, and there is a precaution to be observed with the use of desmopressin because of fear of water overload. Okay, and advise a child not to take more than 1 mg of fluid from 1 hour before desmopressin dose up 8 hours afterwards. Okay, and there is another antidepressant drug, amipromine, for children who do not respond to other treatment. Okay, and this is also initiated by a specialist psychiatrist, for which I'll refer you to a psychiatrist. Okay, and so Mrs. Samina, is everything clear to you? Can I repeat it again? Okay, so first we talk about symptoms of Ali. Okay, and then we talked about examination, that you must bring Ali on the next appointment so that I can examine him properly. Okay, and thirdly we talked about investigations, okay, which are necessary. And fourthly, we talked about lifestyle changes, okay, and how to train him, and rewarding system, and avoid punitive measures, okay. And fifthly, we talked about Enureses alarm, and I clear it to you that for Enureses alarm, I'll be referring you to a school nurse or pediatric Enureses clinic for this alarm. Okay, and they will teach you how to use it, and when to continue till when to continue, and when to restart. Okay, and then lastly we talk about medicine, as you were concerned for vacations and it was difficult for you. Okay, is everything clear till now? Can I repeat? Okay, so Mrs. Samina, here is a leaflet. It includes all the information regarding your child's condition. Okay, and it has all the detail we talked about, and the alarm and Enuresis alarm as well, how to use this gadget. Okay, is everything clear? Okay, so Mrs. Samina, is there anything you want to ask me? Okay, I wish you speedy recovery of your child. Okay, and take good care of yourself and your child. Bye bye.